Hello, hi everyone, a good morning to you all. Welcome back to my YouTube channel. My name is Dr.Privah Blacks, and today I'm going to talk about a simple topic. I'm going to talk about UTIs, the causes of UTIs, the signs and symptoms of UTIs, what causes UTIs, and what you can really do to control yourself from contracting UTIs. But before I talk about them, before I talk about the topic of today, I'm extending my appreciation to everyone who has supported me. Thank you for supporting me. Thank you for loving me. Thank you for being there for me. Thank you for always making it possible for me. Do not stop loving me. Don't stop liking my videos. Don't stop sharing my videos to your families and friends. If you find my videos very helpful and educative, please don't forget to click on the subscription bell. Keep subscribing. Tell a friend to keep subscribing to my YouTube channel. You really make me motivated. You make me feel motivated to keep doing what I'm doing. Just tune in. So today the simple topic is UTIs. What are UTIs? UTIs are urinary tract infections. These are common when bacteria, often from the skin or from the rectum, enters into the urethra and infects the urinary tract, causing UTIs. The most common type, these UTIs that affect the bladder, and another common type, UTIs affect the kidneys. It is known as pyelonephritis. That is the type of UTIs that affects the kidneys. So what causes UTIs? I'm going to keep giving you by numbers, and I'm starting with number 1, causes of UTIs. Poor hygiene, that is our number 1. When I talk about poor hygiene, what do I mean? Do you clean yourself from the backward to the front anytime you are from using a toilet or a latrine? If yes, then you are introducing the bad or the E. coli from the bowel directed to your vagina and then to your urethra, and you end up suffering from UTIs. UTIs affect both women and men. Don't get confused. That is our number 1, poor hygiene. Or if sometimes you don't clean up yourself from morning up to evening, at least for a day, you need to clean up yourself twice. That is poor hygiene. Then we also have other causes like diabetes, or if at all you are suffering from a disease that really lowers the immunity, for example cancers, for example AIDS, for example other diseases that can really lower someone's immunity. Diabetes is our number 2. Or sometimes if you are in a stage, let's say puberty stage or menopause stage, we find that these groups of people suffer from UTIs a lot because there is that overgrowth of the bacteria, the bad bacteria that causes UTIs. Our number 3 is bowel incontinence. Let's say that there is a blockage or there is no flow of urine, or if there is a blocked flow of urine, trust me, you're going to suffer from UTIs. That is our number 3. Our number 4 is maybe having a urine catheter inserted into your urethra. Let's say that this catheter has stayed there for more than a week. You are likely to suffer from UTIs because it will directly transfer the bacteria, the fungus, anything directly into your urinary bladder, and you end up suffering from UTIs. Our number 5 is having sexual intercourse that is frequent and intense with a lot of multiple sexual partners. If you are having a lot of multiple sexual partners and you practice or you have the sexual intercourse together, which is frequent and intense, you are likely to suffer from UTIs. Those are the few causes I can give you today that really bring UTIs into our lives. What comes into your mind when I talk about causes? What can you really do to stop yourself or to prevent yourself from suffering from UTIs? Remember, our number 1 was poor hygiene. You have to mind about your hygiene. You have to be clean. You have to be very, very keen when it comes to your private parts, when it comes to the use of toilets or use of bathrooms or sharing towels. You have to stop sharing towels. You have to keep your pants clean, or if you wash them, make sure you dry them under the sun so that you can kill the bad bacteria that might cause UTIs. You have to seek for medical attention if at all you are suffering from the underlying diseases, for example AIDS, for example cancers, for example diabetes, so that your immunity can be a bit boosted, so that it can stand for itself when it comes to fighting UTIs. You have to stop having sex with a lot of sexual partners, or if at all you cannot control that, make sure that the sex that you are going to have with those multiple sexual partners is protected. You can also go to the hospital if at all you find yourself with these signs and symptoms for medical assistance. So now I'm switching to signs and symptoms of UTIs. What are the manifests for UTIs? In case you are suffering from UTIs, what tells that you are really suffering from UTIs? Our number 1 is frequent masturbation, and you feel that urge of going to urinate, yet you do not have any, or sometimes you go urinate but urine comes in smaller amounts. That is frequent masturbation, or that urge that pushes you to go and urinate every time, yet you have small amounts of urine that you are passing out. Our number 2 is cloudy urine. The urine that you pass out is usually cloudy. It has that top layer that covers it, and it is not always clear. Our number 3 is passing out urine that is too smelly, or urine that has a strong scent, and that scent is always full. Sometimes you're also getting the burning sensations every time you go to pass out urine. When I talk about burning sensations, you feel like there is something that is burning you a little bit and it is not burning too much, so you feel that stinging feeling anytime you go to pass out urine. Our number 5 is passing out Coca-Cola urine that is always pink or reddish in color, because my friends call it Coca-Cola urine. So anytime you find that you have the burning sensations, you have a frequent masturbation, you have that strong urge to pass out urine, you find yourself that you have that stinging sensation every time you go to pass out urine, or you pass out urine which is colored, bright red colored or Coca-Cola colored, or passing out urine which is a bit cloudy, stinking or having this foul smell, you have to rush to the hospital for medical attention, because if you fail to treat UTIs, they develop into PIDs that can maybe affect your fallopian tubes and you end up balding. If you're a man, you can as well keep passing it from one woman to another woman in case you have sexual partners that are multiple. So what are the risk factors that really push, I don't know how I can really term this, but who are the people who are at risk from suffering? Okay, like people who are at risk to get UTIs. I'm just going to give you like 3 categories, and I think people who are in menopause, or people who have this a bit elongated age group, for example people who are 45 and above, they find it difficult because they are the people who usually suffer from UTIs. We have people who have multiple sexual partners. Anytime they have sex that is unprotected, they are at a high risk of contracting UTIs. We also have people who have stress, who cannot really sit down and control their emotions, but every time they are stressed, they're in depression, you know. So we also have this category of people who do not mind about their hygiene, who cannot clean their underwears, who sometimes do dodging, or those who use unclean toilets. They are at risk of contracting UTIs. What is the treatment for UTIs? What can we really give, or what can we prescribe to people who are suffering from UTIs? Most of you have this habit of self-medication. Anytime you see the signs and symptoms, just because you have watched a video on YouTube, you want to give yourself, or you want to prescribe for yourself. It is very, very risky and very, very dangerous, because you don't know what you are treating. It could be the type of UTIs that affects the urinary bladder, or the one that affects the kidneys, and you really do not know the symptoms and signs. So you end up messing up doing self-medication, and it keeps coming, it keeps reoccurring every time you take antibiotics, it keeps coming. So doing self-medication at home is actually not good. What I can advise you is to always go and seek for medical attention in hospitals, or if you have a family doctor, you can contact him or her so that they can help, they can find out what exactly type of UTI you are suffering from, and they prescribe for you the right prescription that can actually heal the exact type of UTIs you are suffering from. I'm not going to clarify the treatment for UTIs, but what I can say is we give antibiotics, and we advise the patient to always drink a lot of water so that it can flush away the bad bacteria from the urinary bladder out, so that you can relieve the symptoms and become fine. If you have any question, if you have any concern about your sexual lifestyle or your mental health or anything, puerperal time, if you're in puerperal time, if you have a mental health question or problem, or if you have anything concerning about health, you can leave it down below in the comment section, because I believe I'm going to read all the comments that you're going to leave down, and I'll give you answers in the next video. If you haven't subscribed to my YouTube channel, please tap on that red bell and subscribe now. Thank you for watching. Share my videos to your friends and families if at all you find them helpful. Keep supporting me. I'm always here to support you, to support the public and my country. Bye bye.